pretty well. I don't know if that's a good thing or not. So welcome to the first snow day of Spokane, at least, and it sounds like everywhere else. I would say that the weather word of the day was crunchy at our house. We had a layer of snow that then froze and it got crunchy. So all in our outlying areas, I hope that your day has been beautiful and is warming up and you're getting ready for the snow. If you don't know who I am, I'm Cindy with the Parkinson's Resource Center. And a couple of things real quick, and then we'll start in with our speaker. Many of you have been coming for a very long time. Many of you, this is your very first time, and I just wanted to make a quick announcement. Our co-founder, his name is Ed Ewell, passed away last Thursday. And so we just want to, this program wouldn't be here without him. And so just a moment to just let you know that, and there will be a memorial for him this Friday coming up, and I have the information for that. But if you have any words that you would like to give his family, you can email or call me, or you can get online. And this organization was founded here in Spokane in 2001. And Ed and a doctor locally founded it, and we're funded and founded and supported out of this area. We love working with other national and regional organizations, but everything you see happening here happens because of what people do here. So, and Ed started that out. So I just wanted to bring that up and keep his wife Jackie and his family in your thoughts. And we're going to keep doing what we're doing so that we can fulfill what Ed was looking forward to. And in a lot of our outlying areas, you will have noticed that you didn't get a postcard. My 2 computers crashed right after we moved our new location. And so postcards will start going out again next month. And my apologies for not getting those out to everybody, because I know those are important so you know where our topic is. And because the computer was down, the calendar just went up on the website last night, and the calendar goes through the end of December. So if you're wondering what's going on, and there's a lot of things going on, please go to the calendar. But for example, we have an educational program happening with Dr. Aldred down in the Lewiston-Clarkston area, and so RSVP or call me for that, or email me for that. We have pedaling for Parkinson's going on 3 days a week at the Y down at the Central Y. Next month, telehealth is Brian Gates with the WSU Pharmacy School going to be talking about updates on medication and new things and interactions. We're excited to have him. And then it also tells you when we're going to take time off for the holidays. That's important. And so I'd like to welcome our speaker. I'd like to thank Merri Jones, and Merri is with the Dental Health and Department at Eastern Washington University, and we're really excited to have her. We haven't had a presentation on dental and Parkinson's for a long time, and so I am going to turn it over to you.
Thank you, Cindy.
Absolutely. Thank you for being here.
Well, thank you all for coming, and welcome. I want to first thank Walt Jacobowski. Walt was at what we call an interdisciplinary presentation at the university last spring, and one of our dental hygiene students asked a dental-related question of the panel, and Walt said, how great if someone could come in to the Teleconnect group and speak on dental health, oral health, and so that's where I came in. I've titled this month's presentation as Dental Health and Parkinson's Disease, Navigating the Dental Appointment. Cindy, a brief introduction of myself. My name's Merri Jones, and I am an assistant professor in the Department of Dental Hygiene with Eastern Washington University at the Spokane campus. We're in the complex with WSU Nursing and Allied Health Programs, Eastern Washington University Communication Disorders, speech and language and hearing pathologies, physical therapy, and occupational therapy, and WSU pharmacy as well. So I'm glad to hear that next month's presentation will step into pharmacology for persons with Parkinson's disease, because I really think this is kind of a stepping off point, and when you attend that presentation, you'll have some foundation dental related questions as well. Keep this steady here. So I think of my philosophy in this arena as bringing professionals from various disciplines together in the shared care of persons with Parkinson's disease. We call this our interdisciplinary approach, and we all share in the care of the patient at the individual level as well as the community level. And the community level is really where we're at here with you now, but to best inform you on dental care from the individual aspect as well. So today I'd like to talk about what your dental team needs to know in providing you optimal dental care, to tailor care to your needs, and what you need to know, and specifically what you need to know to be comfortable and confident in your dental care. I have somewhat of a concern that persons, for many reasons, may neglect dental care because they're not comfortable that their needs can really be met. They're really concerned about the overall situation. So I want to clarify some things here and have you be confident and comfortable in seeking dental care. We'll talk about some general as well as clinical considerations in the management of Parkinson's, specifically in the dental appointment, and talk about some preventive strategies. Many of the strategies for preventing dental disease relate to general populations as well as persons with Parkinson's, but there are some specific risks for dental disease, and we'll address that as well in talking about preventive therapies. And then also the role of the caregiver at given different points in time. Again, caregivers' roles vary, but it's also very common for caregiver roles across the lifespan in addressing numerous medical and dental patient situations. So I want to start by informing that accessing dental care can be a challenge. Not only physical barriers, but communication barriers, finding a dentist, finding someone that accepts your form of payment, your dental insurance, and also persons with Parkinson's disease and other conditions. It is sometimes a challenge to find a general dentist who's comfortable taking on care of patients that require more medical management. But it's important to know that persons with Parkinson's disease don't really have a lot of medical and dental considerations for the dental appointment outside the general population. We can overcome these challenges, but communication is key. We'll talk about communication between the clinician and the client, between the clinician and the dentist, between the dentist and the person and your physicians as well. We'll talk a little bit about medical consult, not hesitating to ask questions prior to dental treatment. As I mentioned, Parkinson's disease doesn't present a lot of any extensive treatment modifications in dental care. In general, Parkinson's disease is treated in dental patient very similar setting and procedures as the general public. But the key again is that communication. And that being said, there are a couple of things that we address specifically in dental considerations for PD. As far as communication, one thing is to keep your dentist and your physician or your neurologist in the loop. You may be asked at a dental appointment to provide your doctor's name for what we call a medical consult. And a medical consult is typically just a brief note saying, we're seeing Mr. Smith for a dental appointment. Here's the procedures we plan to deliver. Here's the anesthetic we plan to use. Are there any modifications to this treatment from your perspective? Do you recommend any changes to treatment or considerations that you would like to inform us of? So again, very important to tailor the care to your needs. Another area of communication is, as I mentioned, it can sometimes be difficult to find a dentist to see a person with, say, Parkinson's disease or other more limiting conditions. So it's very important if you can establish a general dentist early on, establish a rapport, your treatment over the years with that dentist, and keep the communication open. And so at this point then, if you need to be seen by an oral surgeon or have sedation dentistry, there's a clear picture of what your needs are and how those can be met. Another aspect of communication is centered around medications. And so with medications, it's important to know not just what you're taking, but maybe bring that list to your dental appointments and be prepared to provide the time of day that you take medications. And think about, what is your peak performance time with those medications? When does that wane? When do you tend to experience fatigue? So if you can bring a list of your medications to your appointments, as well as the times of day that you take those medications, we can really see that you're being seen at the optimal time of day. And again, this is often related to medication. Also, identify physical limitations, challenges, because again, those can be met. And if we know that ahead of time, we can not only prepare the setting to accommodate all of your needs, but that also means the correct appointment time and duration of the appointment. So in preparation for a dental appointment, be prepared to answer questions such as, how long can you sit comfortably? Do you need frequent breaks to move around? To what degree do you experience tremors or rigidity? Do you have trouble opening your mouth or staying open for a long period of time? We see this with tremors and dyskinesia as well. All these are considerations that we can address, but communicating those really helps for the best tailored treatment plan. Here we go. So again, be assured that your dental team is able to meet your needs best when we know as much as possible. Know also that we are trained and have the facilities for wheelchair access, wheelchair transfer, as well as treatment from wheelchair. It doesn't have to be a wheelchair, just about anything will do. Again, that's more a matter when transfer is a challenge. Because we have dental loops, these are our magnifying glasses, and those loops often have a headlamp, it eliminates the need for the actual physical dental chair with the actual overhead light. Think of it as, have light, will travel. You've got the chair, we've got the lighting. Also with wheelchair transfer, wheelchair treatment, we also often use soft restraints to manage tremors, and mouth props, again, to help you stay open, but also to stabilize the bite. So tremors can continue, but the bite prop or the bite block helps you to stay open and comfortably relax on that bite block. As I mentioned, the management and dental considerations for persons with Parkinson's really don't vary much from the general population. We want to minimize adverse effects of tremors and rigidity, and we want to eliminate and avoid any possible drug interactions. Have a little trouble. Here we go. So again, I'm glad to hear that next month's presentation addresses pharmacology with Parkinson's, because anticholinergic drugs are, for example, one group of drugs that can cause a dry mouth, xerostomia, and we'll talk about that. Sinemet is one of those drugs that may cause dyskinesia, uncontrolled muscle movements over time. And from a dental perspective, this can really impact one's ability to open and to stay open. So in planning that appointment time, we may want an appointment that's a morning appointment. We may want to limit that appointment time to 45 minutes for your comfort. But also, if we find there's a need with the dyskinesia for you to take frequent breaks, we want to build that into your appointment time as well. You may have heard the term TMJ or TMD. This is our temporomandibular joint. And with a lot of people, they can have muscle tightness, clipping and popping. This is the general population. So with the dyskinesia and the tremors, it can add to that challenge of opening and staying opened. Certain drugs such as Tasmar and Comtan, these are drugs that we want to use. We call our cardiac dose of epinephrine. Epinephrine is a vasoconstrictor, and it's what helps keep you numb. It's not a concern at all, but with these drugs, we limit that to a smaller dose so that we don't have what we call orthostatic hypotension, a lightheadedness, or heart palpitations. Most dental procedures, a dental filling, a dental crown prep, are easily maintained within this cardiac dose. So don't be concerned that you wouldn't necessarily be able to have a procedure because of this. It's within the standard range of anesthetic. And orthostatic hypotension, that is a condition whereby we're lightheaded when we stand up and may tend to fall. And we see this with a number of medications, but also just after lying back in a dental chair or even sitting in mainly an upright position. When we go to fully stand up, that's when we can tend to have this orthostatic hypotension. Another more specific consideration in some of the drugs for Parkinson's are that they tend to be CNS depressants. They have more of a sedative effect. And so if a sedative is needed to help reduce tremors and rigidity, we just need to know that that may be an added effect to Parkinson's medications. But again, knowing that, it's adjusted accordingly and safe care is provided. When we look at considerations in management of PD, we think of what we call the motor and the non-motor symptoms. And again, tailor the care to the patient's needs. Motor symptoms are tremor and the resting tremor. Bradykinesia, that's the slow movement. Rigidity, stiffness, and the gait disorder, this is gait meaning your step, and gait being that with Parkinson's, it's sometimes hard to take that first step. For most of us, when we think of dental appointments, we also have a problem taking that first step. So again, rigidity, taking that first step, short steps, and postural instability. Persons with Parkinson's tend to fall backward, kind of rock on the heel and fall back. So then we consider this along with that orthostatic hypotension, where you could be a little lightheaded standing up out of the chair. So again, managing that from the dental provider standpoint as too. So I hope that you know that and be assured that your dental provider is knowledgeable of this and again able to tailor the care and really provide safe care for you. The non-motor symptoms, these are cognitive decline, some dementia, orthostatic hypotension, again that lightheadedness upon standing, dysphagia, the difficulty swallowing. It may be a difficulty in swallowing frequently, It may be a difficulty in swallowing when you're chewing food, and swallowing assessments are commonly done to assess that as well. So if you've had a swallowing assessment, you may share that with your dental provider. That will help him or her really addressing your needs as we use the rubber dam and the suction. They will be knowledgeable of that as well. Urinary dysfunctions, common with a number of medications and condition and aging. The only real consideration here would be to be mindful to empty the bladder before a dental appointment to eliminate that urgency. So keep in mind, these conditions are very common to the population in general as well, but the more we know, the better we can tailor care to your needs. The role of the caregiver, I think of it as across a continuum, across the lifespan, as well as across the medical services being provided. I think the main role of caregivers in assisting with appointments is really facilitating the access to care, maybe making appointments, seeing that a person is able to access care, appointments are easy for their time of day, etc. There's cognitive impairment, such as some dementia, memory loss, or confusion. Keep in mind that medications can add to this as well. When people are simply dehydrated, that can mimic some dementia or confusion. So at some points, there's more need for the caregiver role to step in and communicate, and other times it's really just facilitating the care. So when the caregiver is called upon for more communication during the dental appointment, this would be being mindful of the person's ability to perform their oral care daily. The dental hygienist or the dentist will ask, what are your oral care habits? Are you able to brush morning and nighttime? Are you able to use dental floss? Do you get food stuck between your teeth? Do you have any sores in your mouth? Do you have any problems opening or closing? Do you have a dry mouth? So again, sometimes you are the spokesman for the patient that way. And something that's being asked that in the dental setting, it's sometimes something that you can think about, go home and think about, or maybe keep a record. What are a person's limitations? Or do they complain of aching teeth or cold sensitive teeth, particular dry mouth in the morning, etc. And there may be time when a caregiver is needing to provide consent for treatment. And I noticed there was a presentation a few months ago, I believe it might have been a lawyer, ethical legal considerations. So, power of attorney and consent, some of those things. Sometimes in the dental setting, it's not that level of consent, but more coordinating care and seeing that a person is able to follow through with their care or make an appointment with a specialist. So again, the goal is really to achieve and to maintain optimal oral health. And how that is presented for appointments and procedures varies by each patient. But it's just so important that the patient, that your needs are being met, and we want to eliminate and minimize any of these barriers. So what are some of the treatment modifications that we're making? Well, we look at, again, the patient's ability to perform oral health self-care, oral hygiene, brushing, flossing. So not always different for Parkinson's and non-Parkinson's patients. It's really always tailored on the person's ability to perform oral hygiene and to address their dental needs. With Parkinson's, the literature says that you want to have a dental cleaning and checkup at least every 6 months. And this is because have patients on more frequent recalls. We call that the cleaning, the recall. More frequent dental cleanings when there's any periodontal disease. So we want to arrest the disease, keep the teeth and the gums healthy so there's not any more bone loss or gum problems. And with Parkinson's, the dry mouth and that risk for gumline cavities because of the dry mouth is one of the reasons that we want to see you more frequently. Also, keeping things healthy and having more preventive care rather than restorative care is easy on the patient as well. Another consideration, as I mentioned earlier, is our morning appointments, and appointments when your medication is optimal. If you know there are times of day that you are just spent and fatigued, we want to have your appointment scheduled to not get into that period of time. And that's where it's really helpful to know not just which medications you take, but the time of day that you take them as well. And important to know that stress can do a lot of things, but stress can really increase the tremors and the rigidity. So we want to, again, tailor that appointment to what keeps you in the most comfortable but stress-free environment as well. With medication, the literature says that if you want to have a dental appointment within 90 minutes and up to 2 to 3 hours within medication. But again, knowing when your peak time is, knowing when your off time is for your medication is something that you can best inform the clinician of. So with Parkinson's, those motor symptoms, the rigidity and the tremors, probably one of the biggest concerns because as we all know, we need to hold still for dental appointments. But we're able to manage that with sedation at times when necessary, soft restraints, kind of a papoose or something to steady the wrist, the tremors. And those tremors can be commonly unilateral but bilateral as well. So if, say, the left arm is tremoring more, we'll just simply use a soft restraint on the left arm and help stabilize that. We use several things in dentistry to isolate our field, and they work really well for persons with Parkinson's also, with very little alterations in how they're used. We have the rubber dam, the mouth prop, also referred to as a bite block, and we have our suction tips. We have a few types of suction tips. The rubber dam, as I'll show you here with a picture in a minute, isolates the field. And the nice thing about the rubber dam is that it isolates the field. We're able to use a suction tip in front of the rubber dam, but also take a straw-like suction tip and put that behind the rubber dam. By isolating the field with the rubber dam, it controls the tongue movement, and the person is able to swallow independently behind that rubber dam. So again, controlling tongue movements, tremors to a degree, and then swallowing. Again, wheelchair transfer, wheelchair care are both very common in dentistry. I've got a couple of pictures here. The first picture looks like it's a video, so if you go back to this presentation, it's not a video, it's just part of the picture. But I want to use this to show you that what you see in the background is the dental operatory tray. It's got the hoses there for the hand pieces and the suction tips. And to know that this chair is perfect. We don't need anything more than this. I have a client that I would see when I worked in private practice, and she has MS, and we went from wheelchair transfer to treatment in the wheelchair to treatment in a really fancy wheelchair. It would raise up from the bottom, but it would also tip her back a little. And so with my dental loops here, I had my headlamp, and which is good because the dental lamp in the ceiling was positioned over the dental chair. I wasn't able to move that around the room, so I could really treat her for wherever she could place the wherever we could put the wheelchair that was comfortable for her. That's where we could deliver care. And of course, it's within, probably about 5 or 6 feet of the dental unit because of the dental hoses and the hand pieces. But we have, wide doorways and larger operatories to accommodate wheelchairs very easily. Got a couple of pictures here. The picture on the left is a newer section unit. We use this one at the university. It's called Isolite. They have Isovac, and they have Isodry. And what you see here, this first piece, this is our section. And what's a little harder to see is right back in here is a clear, flat piece, kind of like a balloon that's not blown up at all. And it's got small holes in it. So what's a little hard to see is everything right in here is a small flat piece that's shaped like this. It's just inserted, the patient closes on it, and suctions the water. The picture on your right is the dental dam. We have smaller dams now, and we just isolate the teeth that are being worked on or right in that area. And what we don't see here is a suction, but again, you can see that the dam allows for independent swallowing and tongue movement. The clinician has a little larger suction about the size of a dime that we use in the front of the dam, and then the small straw, like a bendable straw, that is just placed right behind the dam, right in the patient's mouth. And again, you can actually close on that to suction the water, and it'll suction as it goes. So again, it accommodates tongue movement, opening and closing, because this serves as a bite block too, and also keeps the field dry in the front and suctioned from behind. So again, physically there in the chair, we've got the bite block, the rubber dam, and various suction devices to help in comfort, drive the field, and help maintain stability. And all of these can be easily used from an upright position too. A person doesn't have to be lying back for any dental care. Thanks to technology and materials and a number of things, that's just not the case anymore, to be lying back or to be actually in the dental chair. Probably the main treatment modification that we see in adults in general is addressing dry mouth or xerostomia. With Parkinson's, people sometimes think that patients have drooling when really you're just not swallowing as often. And so you think, well, why is it that I've got drooling or more saliva? Why am I having a dry mouth? Well, one of the main reasons is the drugs. Anticholinergic drugs are just notorious for causing a dry mouth. Dry mouth is also caused simply by combination of drugs. Two drugs that may not independently cause a dry mouth, but put them together, we call that polypharmacy, and we see a dry mouth developing. The dry mouth is a real risk for dental decay. Not as much for gum disease, but a risk for dental decay. And the reason is we form bacterial plaque in the mouth, and this is the bacteria that causes cavities. And when it's dry, it's more of a full strength because saliva gives us a protective factor. Saliva is somewhat like nature's fluoride. It does help to remineralize the teeth. And so we've got some products that we use for dry mouth. Several of them are fairly new. Traditionally, we've had fluoride, but now we have prescription strength fluoride toothpaste, such as the Preventive 5000, and I've got this in the literature and the PowerPoint for you as well. And over-the-counter OTC mouth rinses, some mouth moistening products, saliva substitutes, and saliva stimulants. And that would be where someone has the saliva function, we just want something a little bit sour to stimulate the saliva flow. Also, electric toothbrushes and manual toothbrushes that have adaptive bristles or adaptive handles. Got a couple of pictures here for you on these. On the left, we have a prescription strength fluoride toothpaste, probably one of the most common, the Colgate Preventive 5000 Plus. The 5,000 is how many parts per million of fluoride there are. An average toothpaste has about 1,000 parts per million. So this has a lot more fluoride, and it can be a toothpaste or it can be in a gel that's applied at nighttime. On the right, we have some mouth moistening products. The Biotene is a very popular product. There's liquid Biotene mouth moisturizing liquid. There's they have lozenges and they have gum. And I was reading on a blog, a person with Parkinson's, he said that he was better if he was able to chew gum. It helped him to manage the tremors a little better. And so I thought, well, that's great because they have the Biotene. It's got the mouth moistening gum as well. A newer product is the Xyla Melts. And xylitol is a natural sweetener. There's xylitol and sorbitol and mannitol, but xylitol is a natural sugar that you see used in a lot of gums now. And it's not only that it's sugar-free, but it interferes with the way that the dental plaque sticks to the teeth. So it actually helps to prevent cavities in that way. And I recently purchased this product for a friend with Parkinson's. She likes them. The troche, the little tablet, is sticky on one side, and so they recommend placing it up next to the tooth. It's sugar-free, so there's no problem causing cavity, but it actually sticks to the tissue, and you put that in particularly at nighttime, and it's time-released or just slowly melting, and helps keep the mouth moist through the night. So when you see products that have xylitol, they're not only sugar-free, but they're actually preventive for decay to an extent because they help interfere with the bacteria sticking on the teeth. Another condition we refer to as bruxism or clenching or grinding is also closely related to Parkinson tremors. How we address bruxism is to have a bite guard or a mouth guard fabricated. You do have an impression taken. It takes about maybe a minute with the mouth open to have that material form, and then these custom trays are made. The custom trays allow for a person to continually to clench or to grind the teeth, say at nighttime. But by having that spacer there, the forces of clenching are spread out, so the teeth that are getting most of the grinding don't take the brunt of the force. And also, if a person's grinding, moving the teeth together, they'll wear a spot or wear on the bite guard before they wear into their natural tooth tissue. The nice thing about the bite guards is we use these also, the same type of a guard, to make custom fluoride trays. Custom fluoride trays, trays that you put the fluoride in and then put that in at nighttime. For the most part, applying a fluoride gel and extra strength fluoride toothpaste twice a day and always at nighttime is probably just as efficient of a source of fluoride as the custom trays are, but they are an option. We talk about electric brushes. There are a number of brushes out there. They're not all created equal, but most dentists and the periodontists that work with the health of the gum and the bone, they're both saying that the Sonicare brush by Philips and the Oral-B Braun toothbrush, they work a little differently. They have different shaped heads on them, but they're both efficient in plaque removal. It's a little hard to see from the picture here, very hard actually, but the Oral-B Braun has a round, oscillating, rotating, and pulsating head. So you angle that to the tooth, and it does the rotating motion and pulsates. It does a little bit of an in and out, so it helps you reach around the gum. The nice thing about that smaller round brush, is you can do it one-handed or two-handed, and you know which tooth you're on and walk your way around. The Sonicare has the more traditional head. It's elongated, kind of rectangular, or it comes to a point, but it's not a circular. With the Sonicare brush, you don't do a brushing motion with it. You angle it between the tooth and gum, and it does the vibratory motion. I recently was given a Sonicare brush and Oral-B Braun brush at a dental meeting, and I gave it to someone with Parkinson's, and I noticed that she noticed it and mentioned it to me, and she said, "Merri, I can't turn it off. This little button here, it's one of those buttons that's kind of rubbery. You have to really kind of push on it to get it on, and push on it to get it off." So that was a little bit of a challenge, and I talked to them at Oral-B about that. And so if you have one of these electric brushes that you have a brush, that button's hard to turn on and off, I suggested to her that she find this spot on the counter, put it up there, kind of lean into it to turn it on or off. But again, one of those things that needs to be adapted. Let's see, Cindy, am I here? There we go. I talked about adaptive toothbrushes. Toothbrush doesn't have to be electric. One brush that's been around for a long time is the Collis Curve brush, and it might be a little hard to see from the picture, but what looks like a loop is actually separated so that when you place the brush on the teeth, there are bristles on both sides of the tooth. And then there are adaptive handles that provide for a larger grip as well. Another grip that's nice is, I've seen for even a larger grip, is a tennis ball. Tennis ball on it as over the toothbrush handle for a larger grip. This is a toothpaste dispenser that I read about a couple of months ago as I was reading a website, a blog that a person with ALS had put up. And he said he purchased the One Touch toothbrush dispenser someplace, local, Walgreens or Target. And how this works is you insert the brush, and just by pushing on a lever, no batteries required, just pushing on the lever, it dispenses the toothpaste onto the brush. There's two different toothpaste dispensers there. One thing he did note was that if you're using the toothbrush that has the round head, it's probably going to dispense a little bit too much, because how it works is as you push on the lever, your toothbrush is going in. But again, a nice one-handed approach to toothbrushing, and I say anything that makes things easier works for me. As I mentioned, dry mouth, the xerostomia, is very common because we get a dry mouth as a result of medications or the combination of medicines. But those anticholinergic drugs are, again, notorious for causing the dry mouth. So what puts us at risk for cavities when we have a dry mouth are a few things. With or without gum recession, this is where the gum tissue may move up or down and expose the root of the tooth. That root surface is so much harder than enamel. Enamel is the hardest tissue in the body. It's harder than bone. But where the plaque forms along the gum line, the cavity isn't so much on the enamel, but it's right below it on that softer root surface. So what we tend to get are these little patches that you see right on the root surfaces there. In dentistry, we call these class 5 restorations, and it just simply means cavities right at the gum line. So this is where our prevention, the fluoride, really comes into play. Dental plaque is at the gum line. It's more concentrated. We don't have the natural benefits of saliva to reduce the acidity and have increased risk for gum line cavities. The picture on the left, on the right, is, of course, the gumline cavity, and the teeth have been restored, as you can see on the picture on the far right. But not only are these what we call tooth-colored restorations or tooth-colored fillings, but these fillings actually have fluoride in them. So after the fillings are placed, they continue to release fluoride into the tooth. So dentistry has come a long way. So in summary, our goal is to provide and maintain optimal oral health. We want to ensure that everyone knows that their needs can be met through dental management and considerations, communicating with your clinician, the dental team, your physician, and keeping them communicating. That's what's really going to help you achieve the best dental care and long term. Persons with Parkinson's don't need any real considerations outside of general dental considerations, but the drugs that you're taking can tend to cause more of a dry mouth, and there may be a time when you need sedation dentistry as opposed to general dentistry because of rigidity or tremors. At that point, by having a good long-term relationship established with a general dentist, he or she will be able to really seamlessly see that you are connected with a specialist or with a sedation dentist or with an oral surgeon for an extraction or an oral surgeon for an implant. Again, we think of it as the interdisciplinary team, the whole team that manages your dental health. And while it's the dentist and the dental hygienist, really with that scope of practice of providing dental care, it's all of your healthcare providers, your nurse practitioner, your pharmacist, your neurologist, your cardiologist, your physician. We all play a role in the shared care of your health. So thank you very much. I have my contact information on our slide here, and I feel, Cindy, do you put this up on the website?
What I'll do is it'll have the title of the presentation, and then it should have that, and if it doesn't, they can contact me. Okay. It depends on how awake I am when I'm updating the website.
Okay.
But it'll have your name and where to get a hold of you, and then they can get a hold of me, and you will send me a copy of your presentation. Is that okay?
Right here, yeah.
Perfect. Okay.
I'll send that email.
Because there's a lot of good information, but like the Colgate and the different things, it's good information I know I'll get asked about. So out in our outlying locations, if you will unmute your mic and as usual tell us how many people are attending and if you have any questions. And let's start with Anchorage, Alaska. And you know what? They're currently getting hit by the biggest storm on the planet. So maybe I didn't even think about that right now. So maybe they might not answer.
Yeah, they are the starting point for that one.
I hope that they're doing okay. And if I miss anybody as I'm going down the list, we didn't catch everybody who signed in, just jump in at the end and let me know. Clarkston Tri-State Memorial.
Okay, everybody just left. What are you needing?
How many were attending and if you had any questions?
There were 7 that attended today.
Thank you. And this is Clarkston?
Yes.
Okay, thank you very much. Take care.
All right.
Coeur d'Alene Kootenai Medical Center.
Yes, we had 4 people attending. No questions.
Thank you. Moses Lake Samaritan Healthcare.
Hi, we had 10 people attending and no questions.
Thank you. And thank you. Is Sandy there? Tell her I got her email on the update on the address. I'll put it in the next mailing.
She's here.
You're welcome. And Pullman Regional Hospital.
There are 3 people attending. I'm asked to say that this was a wonderful presentation. 1 question. Recently on television, there have been ads showing a tape you place at the base of the tooth to decrease sensitivity. Will that tape also help with preventing gumline cavities, or is there a similar tape that you can use?
That's an excellent question. No, it does not have any fluoride. It will not address any or prevent any gumline cavities. The strip that our participant is referring to is a new product to the market by Oral-B, and much like the whitening strips that you see, it's a strip for sensitivity and addresses the sensitivity that we have, such as cold sensitivity. If we brushed a little hard and nicked those little nerve endings, that's what that addresses. But no, there isn't anything preventive in that other than reducing sensitivity at the gum line. Thank you.
Do you anticipate an additional strip coming out in the near future to help with gumline cavities?
Probably not, in that it would be something like those tooth whitening strips. It would have to stay on the teeth for a period of time, and they get a little slippery. The best thing to do is adequate, plaque removal on a daily basis, and using a prescription strength fluoride, particularly using the prescription strength fluoride at night. And also, when you're using toothpaste, and especially if you're using the prescription strength toothpaste or the gel, spit out the extra toothpaste, but don't rinse. You want the toothpaste and the gel to stay on the teeth. Rinse, brush the tongue. For years, I rinsed all my toothpaste off, and then went, wait, the fluoride's here to help prevent cavities. So, and with the gels, you actually brush that on or apply it with a little tube at nighttime, and so you're able to really apply it along the gum line where it's needed, and it stays working through the night. Thank you.
Thank you. Good question.
You said that to me.
Okay, Tenasket, North Valley Hospital.
Hi, there's one and no questions.
Hi, thank you. And Walla Walla, Providence, St. Mary.
There are two of us here.
Welcome, thank you.
We have no questions. It was a nice presentation.
Thank you for being there today. And do we have any questions in Spokane at this time? I just need to get the microphone.
You going to?
It was very interesting. I didn't know with Parkinson's, we have more trouble with our teeth, I understand. Does that show up in the insurance? Do insurance coverage more for us with Parkinson's than not? Medicare cover any of that stuff?
No, not separate from any other dental care.
Well, that's got to be wrong.
Yeah.
Thank you.
Got to work on that.
Yeah. And are we good? Well,
see, in prevention, more frequent
if
care.
you think of any other questions after the presentation is over today, you can always contact hours or now noon to 4, which are the same as at our old location, but somebody is there all the time during that Monday through Friday. So, but you can also contact us by our phone number at 509-443-3361 or by email at center@SpokaneParkinsons.org. But thank you so much for attending today. Did you have one more? In Colville. Okay, we missed you. Okay, Colville, did you have a question? We can see you, Colville.
Can they hear us?
Yeah. He's trying. It looks like maybe he's holding the mute button down. I don't know.
Can you hear us now?
Yes.
Okay. Okay, so ask her.
Yes, my dentist says I should have my silver amalgam fillings taken out. What do you think of that?
What?
There's talk of people wanting to have their silver fillings removed because of the mercury and replaced with tooth-colored fillings. We don't recommend that. It's a stable compound, and so for that reason, taking them out and causing that aerosol breakdown, it's not evidence-based, so we don't recommend it as a general practice. The other thing is the tooth-colored fillings, they're not without their problems. The silver fillings do tend to conduct heat, take up stain and some other things, but the tooth-colored materials, they're not 100% perfect either.
Okay, thank you.
Yes.
Thank you. Colville, how many do you have attending today?
2.
Thank you so much.
Cindy, Anchorage here.
Who's that?
Anchorage
Anchorage,
here.
there you are.
Oh, there they are.
Yes, we have 4 people.
And are you seeing much of the storm that the rest of the country is hearing about up there?
No, I wish you could say that we were being punished by that dreadful storm, but it's actually rather glorious out right now.
Oh, good. Good.
Yeah.
Did you have any questions today?
Any questions, anybody? Nope, that was a very comprehensive and well done speech. Thank you.
Thank you so much for.
Thank you.
And then looks like we have a question here. Thank you, Anchorage. Take care.
I was wondering if there could be gum thinning in areas where not only where the gum actually meets the tooth, but kind of below that. Because I noticed, like, when I shine a flashlight in like people's mouths, I noticed that in some areas it looks like the gum is thinning, or it seems somewhat transparent, and you can see like the very base of the tooth. Do you know what I'm talking about?
So you're asking if the gum can be thinned?
Yeah, if there's like exposure like somewhere else besides where the gum line actually meets the tooth, like further down maybe. Thinning of the gum tissue and at the root.
There's a procedure called gingival grafts. And let's see, I'll come back here. In the picture here, there's a procedure called gum grafting or gingival grafting, where commonly a thin, just one layer of tissue from the palate is removed. What do we call it? It's kind of like a cheese slicer. You just take off just one layer of tissue, and it's patched on there or grafted on there so that it can give root coverage. Mm-hmm.
Thank you.
You're welcome.
I think that.
Oh, I was right. I go down to you, close to your place with my speech help.
Yes.
Does your clinic treat people like me with Parkinson?
That's what I was just going to say, is for the information that I'm giving to Cindy, and I'll bring some brochures as well to the next meeting. Yes, we accept dental patients at the clinic.
Oh.
And we have 3 classes of students, and our second and third year students see dental patients. We have a clinic with 45 dental chairs. And we just had you may not have heard about it. We had, as part of Spokane Tooth Week a couple weeks ago, we had Give Seniors a Smile, and we had the clinic open for oral cancer screenings for seniors, and then communication disorders, did hearing assessments, screenings, and we had physical therapy do a gait assessment, balance assessment, and we provided pharmacy, nursing provided flu shots. So we'll make sure that gets advertised next year as well. And in February, we have a day where we serve veterans in the community, a Saturday of dental care for veterans at a much reduced fee.
That the information flyer on the event you had earlier this month made it to Facebook, but the rest of the things it didn't make it to because the computers were down.
Yeah, I know that's a computer problem.
But that's great to know that you have a clinic
we'll get that up on the...
Yeah, we'll put that up and we'll make sure that we'll include that on all of our things, that there's a clinic that they can go to. I think we're done. Thank you so much for joining us. If you have any questions, let us know.